My name's Will Akard. I'm one of the vascular interventional physicians at Spectrum. It really is about patient-centered care. It's one thing to have a command of all the scientific knowledge and physiology. And of course, in my specialty, we are proceduralists, so there's a lot of technical skill involved and just experience knowing how to do procedures. But none of that really matters if you don't know how to tailor it to individual patients. So I really never know what I'm going to be doing procedure-wise when a patient comes in to see me. If you were a question on a test, I could look at your images and tell you, all right, this is what we're going to do. This is the correct answer of how to treat your problem. But some patients, if you're really not having that many symptoms, if it's not a problem that's going to really harm you, sometimes I do nothing, and sometimes we have to be really aggressive. It really all depends on what your priorities are, how you're actually feeling. It really is all individualized. I know it's a pretty esoteric specialty, vascular and interventional radiology. Not a lot of people have heard of unless you're in the healthcare field. It's basically just doing procedures, you could call them minor surgeries inside the body, really anywhere, anything you can do using needles, catheters, other little microscopic toys, using x-rays and ultrasound to see what we're doing, hence the radiology part. So it's basically minimally invasive procedures. So say you have blockages in the arteries going to your legs, there are lots of surgeries that the surgeons can do to fix that. Well, we can, through just a little poke through one little site to get into your arteries, do all the work from inside out. So it basically is the least invasive way for us to treat a lot of problems. So it just opens up less invasive ways of treating things that otherwise would require big incisions, anesthesia, stays in hospitals. The vast majority of what we do doesn't need anesthesia, and you usually can go home the same day. So as far as its effect on the community, it's just nice to be able to offer something that's a little bit more patient-friendly, a little bit less intense, a little bit less scary, but still treat a lot of issues with just as much efficacy as actual surgery. And the great thing about Spectrum is it's small. We're a small independent group, so I'm not beholden to some administrators and bean counters telling us how we have to run the practice. So if I need to spend 45 minutes with a patient in clinic just going over questions and helping them feel at ease about an upcoming procedure, I have all the freedom to do that. I don't have to rush through 10 patients every hour. We're allowed to treat patients as we see fit instead of having to do what someone else tells us to, which is great.